Good afternoon, everyone, and thank you for attending the webinar, Children's Rights and Adaptation to Climate Change, Challenges and Opportunities for Child Participation. This webinar is already the third webinar organized by the Global Campus Alumni Association in collaboration with Right Livelihood Foundation. My name is Mariam Radian, and I'm a Global Campus alumni, and I'll moderate today's discussion. Our beloved speakers are Elizabeth Robinson, Shuro Dasgupta, Michael Boyland, and Raul Montenegro. As we well know, environmental damage is a pressing human rights challenge, which affects people at any age. Children are particularly vulnerable due to their evolving physical and mental development and status within society. Children are indeed important agents of change and can directly develop projects on the ground and participate in local, national, and international activities and campaigns. Some of the questions we'll touch upon are: what are some of the effects of both gradual temperature increase and extreme climate change, such as drought and heat waves on children's health? What are some of the adaptation measures and targeted actions that build resilience? What are the enabling factors and best practices for youth and children to engage in climate change participation? Before giving the floor to our speakers, I want to encourage you to submit additional questions to those already we received through the registration using the chat. So to use the chat, you have to just click on the chat icon at the bottom of the screen, and window will appear on the right. At the bottom of this window, you can write your question. Please address them to the whole floor by pressing everyone or to all button, not directed to one speaker. So we schedule approximately 50 minutes for this webinar, and we'll try to answer as many questions as possible. Now let me introduce our first two speakers. Today we are delighted to have with us Elizabeth Robinson and Shuro Dasgupta. Elizabeth is a professor of environmental economics at the University of Reading with over 25 years experience undertaking research in lower income countries. She has the first-class degree in engineering, economics and management from the University of Oxford and PhD in applied economics from Stanford University. Shuro is currently a researcher at the European Mediterranean Center on Climate Change, CMCC, and at the European Institute on Economics and the Environment. He is also a lecturer at the Università Ca' Foscari Venezia. His research investigates the impacts of climate change on labor, inequality, human health, food security, and migration displacement. Shuro, Elizabeth, it is our pleasure to have you here today, and thank you for joining us. Global warming is already affecting public health, and efforts to address the problem are inadequate. Children born today will face a lifetime climate change-related health problems. So why are children uniquely vulnerable to climate change threats? And what are some of the most relevant findings of CMCC studies combining high-resolution climatic data with children's health to estimate the effects of both gradual temperature increase and extreme climatic change, such as drought and heat waves? Elizabeth, Shuro, the floor is yours.
Thank you, Mariam. And I'd like to thank the Global Campus of Human Rights for organizing this webinar and inviting us. The question you posed is, of course, extremely important. And what we'd like to do is have a short PowerPoint presentation to go into the details of how climate change and warming in general is affecting children's rights, not just historically, but also how we might see these changes evolve in the future due to climate change. Show my screen. Okay, so this is a joint work between Elizabeth and myself, in where we use data at the subnational, so within country level, on child health, and combine this with high resolution climatic data on various stressors to look into these impacts. So we know that climate change effects, or changes in climatic variables, affects human health in multiple and complex ways. The mechanisms and the pathways are very complex, right? The literature on this is evolving, but most of the literature actually focuses on adult health in general. And child health has not received as much of attention that we would like to see. Our paper goes or attempts to fill this gap, right? So the impacts of climate or climate change vary across, or the change over time, and of course across space. And this is something we need to understand using subnational level data. So often studies will use country level data, but that sort of misses the issue that most climate impacts are localized, right? So what we attempt to do is quantify the link between climate change and child health with an aim that our scientific evidence can influence or can be used in implementing tailored policies to mitigate these impacts. We focus on a number of indicators, including child mortality, malnutrition, growth retardation, under height compared to the peers, underweight compared to the peers, and so on. We combine these indicators of child health with climatic data to estimate robust relationships between climatic stressors and child health. And as you mentioned gradual and extreme events. We control for both, or we study both. We take into account gradual increases in average temperature, but also extreme events such as drought and heat waves. And as we know that even in Europe, a developed region or high income region, heat waves result in high mortality levels. But along with these climatic stressors, we also look into how income and education may reduce these negative impacts of climate change, right? So we look into the inequality aspect of this relationship as well. So our work is highly data driven and with a lot of focus and emphasis on methodology. And the data comes from household surveys from 119 countries between 1991 and 2018. So we look at 1,300 subnational regions. So subnational regions would be NUTS2 equivalent in Europe, counties in the United States, and so on. The data we have provides us information on socioeconomic information, such as income and education that I already mentioned, health outcomes, demographic information such as age and gender, dependency ratio, and a whole lot of others. Along with temperature, which is our main variable of interest, we also look at drought using the standardized precipitation index, or the SPI. This is a well-used indicator of climate change in terms of precipitation. And this looks into how monthly precipitation changes from a long-term trend. For heat waves, we use warm spell duration, which essentially looks into the annual count of days that the daily maximum temperature was above the 90th percentile. So this is when human bodies cannot adapt to long periods of exposure to high temperature levels. Moving on to the child health indicators that we look into in this paper. The first one is neonatal mortality. So this looks at the number of neonates or children dying before 28 days. So this is really looking into newborns. So number of neonates dying before 28 days of age in a given area per 1,000 live births, right? We also look at infant mortality, which looks into mortality of children less than 1 year of age. And then the third indicator is under 5 mortality, number of children below the age of 5 who die. And of course, this is a share of 1,000 live births in a given year. Along with the mortality indicators, we look at underweight indicators, or the share of children between the age of 0 and 59 months in an area who are below 2 standard deviations from the median weight for age according to the WHO guidelines. So essentially this compares children to their own peers, and if they are well below the median weight for age ratio. And the same with wasting, but instead of weight, we look at height. So we compare children in a given area with all the children, with all the other children in that area, to understand if their height and weight, of course, in the case of underweight, are adequate, right? And what we pose, the question we pose is that, is climate change affecting all these indicators? So the data, so we use high resolution data, not just for climate, but also for these health outcomes that we look into. And as I mentioned, we have data from 1,300 subnational regions from 119 countries. And this two maps simply shows the distribution or where our data comes from, right? And so we look at, let's say, district level in Bangladesh, or state levels in India, or provinces in Vietnam, or counties in Kenya. So really going into the local level to understand these impacts. I'm not going to spend a lot of time on the methodology, but this slide is just to show you that we have a very robust methodological approach to our work. We use an econometric approach or regression to estimate a causal relationship between climatic stressors, socioeconomic drivers, and child health. So we want to answer the question with this methodology, where the question becomes, what is the impact of climate change on child health? And the second question is, do socioeconomic drivers such as education or income levels help reducing these negative impacts of climate change, right? So we control for a whole range of variables, and we are confident that the results we get are robust. If anyone's interested in knowing more details about our approach or have specific questions, please feel free to get in touch with us by email or Twitter, and we'll be very happy to provide you further information. Let's jump into the results. So we have lots of results, right? But what we want to emphasize is that if we look at this figure and we look at the shape, so this is a U-shaped relationship, right? So what we obtain from our econometric estimation is that as temperature increases, right, mortality at first declines. It declines until, in the case of neonatal mortality, until about 17 degrees Celsius, right? So as temperature is initially increasing, mortality declines with it. But beyond this threshold, right, beyond this 16.7 degrees Celsius, any further increases in temperature or any further warming actually results in an increase in mortality. So this is a non-linear relationship, right? So at first, warming helps to reduce this child health outcomes, especially in mortality. But beyond the threshold, warming actually increases mortality. And this is important to know, or this is important to understand, because we want to know at some point which countries are sort of in this range of optimal temperature that we estimate, right? Because this relationship tells us that further warming will increase mortality. And we know that in the future, we will have warming increasing, or temperature, or average temperature will increase globally, but also, of course, in subnational regions. Moving on to the other child health outcomes, right? So we obtain similar relationships with initial warming, mortality declines, share of underweight children declines, share of wasting declines. But beyond this optimal temperature levels that we estimate, any further increases in average temperature results in worsening child health outcomes. And this is critical. This is very, this is a matter of concern, because we know that in the future, warming will continue to increase until or unless we implement policies to mitigate these warming issues or mitigate climate change. So as I mentioned, with initial increases in temperature, all child health outcomes initially improves, right? Mortality declines, share of underweight children declines, and so on. But beyond the thresholds that we compute, child health outcomes actually worsens. And again, as I keep mentioning, this is a cause of concern. Talking about the extreme events of drought and heat waves, increase in the number of both drought and heat waves worsens child health. The second part of the question we asked was, do socioeconomic drivers improve child health? We find that yes, education generally leads to an improvement in child health. Higher income and wealth improves child health. So this is about income inequality. So we find that inequality is an important determinant of health outcomes. Elizabeth will touch upon this in the second part of this discussion. So we find that optimal temperature is between 16.7 and 19 degrees, about 20 degrees Celsius. Some of the countries that are already in this range are Lebanon, South Africa, Algeria, Syria, Pakistan. But importantly, countries such as Tunisia, Rwanda, Zimbabwe, Ethiopia, Kenya, they're already beyond the range, right? So they're already facing worsening child health outcomes due to warming. What we do is we use these results to compute future impacts, right? So under two scenarios, moderate, which is between 1.4 degree warming by mid-century and 1.8 degree warming by the end of the century. And RCP 8.5, which is an extreme climate warming scenario, where we will expect a 2 degree warming by 2065 and a 3.7 to 4 degree warming by the end of the century. And we look into this impacts, right? So and we compute this again at the subnational level. And what we expect is significant increases in mortality. Neonatal mortality is expected to increase by between 11.4% and 18% by 2070. So huge increases in mortality due to future warming or future climate change. In fact, all the health outcomes that we have looked into, infant mortality, we can expect up to 16.7 degree increase by 2070. That is a significant increase, especially in countries where child health or the public health infrastructure is already inadequate. And the same goes for mortality and of course, the wasting and underweight. I finish with this slide where we identify some of the countries that are in danger, such as Sudan, Ethiopia, Kenya, and Mauritania. For the second part, Elizabeth will put everything into context, all these results. And thank you for attention. Liz, it's to you now.
Thank you so much, Shura. Shura has put together tremendous data sets, tremendous analysis to come out with these findings that we think are sort of critically important. So I've just got a couple of slides where I'm going to talk. It's interesting that there's sort of two themes, I guess, that I want to bring up, and one is inequality. And I think to some extent, when Shura and I have been doing this work, when we haven't particularly focused on children, when we've talked about inequality, we've talked about the fact that you know, if you've had better education, if you're wealthier, if you live in a wealthier country, then, you know, you're going to cope better with climate change. But I think increasing this work that we're doing really shows that there's inequality across age as well. So it's not just across geography, it's not just across wealth or education, it's across age. And I think this really highlights that inequality in terms of children versus adults is important to look at. And like Shura said, we just haven't had enough data. So what we've shown first, look, let's just quickly think what we've shown. There's a clear link between child health and temperature. And in fact, there's sufficient data to show that if you think about a child born today, their life outcomes and their health is really going to be defined by climate change. And that may sound sort of very dramatic, but the data suggests that that's really true. If we think of children under 5 at the moment, they're going through rapid physiological and emotional development. They're particularly vulnerable to diseases like malaria, dengue, cholera, each of which is going to affect them worse because of climate change. They're particularly vulnerable to food shortages because they need more food and water per unit of their body weight. So they're particularly vulnerable to the food shortages, the harm to harvest that we're increasingly seeing due to climate change. They're particularly vulnerable to air pollution, something that is directly contributing to climate change. So it's not an exaggeration to say that if we don't really deal with mitigation of climate change, children are going to be harmed. And Shura has presented, you know, the work we're doing, just one particular aspect of this. And I think there's sort of, our work just shows that there's going to be an even greater imperative to address these issues if the child impact is emphasized. And I tend to talk particularly about mitigation. And, you know, this idea that if we look at child health across the planet, we know that if we reduce climate change, we're going to improve the health of children across the planet. But also the reality is that the inertia linked to climate change is that we know we're going to have these high temperature increases. And so there's a broader discussion about the need to look at adaptation and where that adaptation is particularly needed. And low and middle income countries is where these children are particularly going to be affected. In part, as Shora showed us, a lot of the countries that are seeing the particular effects of climate change where heat is already a problem are countries that we would classify as low or middle income. And so there's this really strong need as well to think about where adaptation occurs and how we can build resilience in child health and resilience more broadly. We know that many low and middle income countries have already invested heavily in child and maternal health. We know that increased wealth, increased education matters, but we know also that climate change is negating a lot of these efforts. So I think I want to leave plenty of time for discussion later and questions, but I think what our research shows is yet more evidence that mitigation and adaptation are needed, particularly for low and middle income countries. And if we care about children's health, if we care about children's well-being, we can't separate that from what we do about climate change mitigation and adaptation to climate change. So I think that's all I'll say at this point. So thank you.
Thank you very much.
Thank you. Thank you, Elizabeth. Thank you, Shora. I think that it will raise many questions among the audience because it's raised questions for me too. And thank you for pointing out the necessity to focus on child mortality and its indicator, underweight and other health data on the effects of child well-being. The approach you use looks very interesting and specific in terms of evaluating the climatic negative impact. And of course, Elizabeth, the social disparities and inequalities you mentioned about low and middle income countries gives us a lot of room to ponder about. Thank you once again. Well, now I'll pass the floor to our next speaker. This is Michael Boyland. Michael is a research fellow at the Stockholm Environmental Institute Asia Center, working on climate change, disaster and development. His work focuses on the gender and social equity dimensions of risk and resilience, for example, through understanding how women, young people, and ethnic minorities are particularly at the risk to climate change and disaster across Southeast Asia. Many thanks, Michael, for joining us. In your experience, what are some of the forms that adaptation as an essential but often overlooked pillar of climate change action can take? And what are some of the examples of adaptation measures and actions that can be taken to build resilience, engagement, and participation of young people and children? Michael?
Thank you very much, Mariam. Good evening, everybody from Bangkok. It's great to be here. Thank you to the organizers for putting this event together and inviting me here today. So I have a few reflections from some of my work in Southeast Asia, which I think are quite complementary to the amazing work that was just presented by Elizabeth and Shara, who I think gave us a lot of information, a macro study from across the world. And I want to kind of pick up on something that was said right at the beginning, which is how the impacts of climate change, particularly on children, are very localized. So I'd like to pick up on that by talking about an example of some work done here in Thailand over the past couple of years. But first, I think I wanted to pick up on something in your question there, Mariam, and which was also just mentioned by Elizabeth, about the role of adaptation within climate change action. I think that there is a much bigger attention on mitigation, perhaps rightly so, given the urgency. I think given the macro issues around fossil fuel use, green economies, and the need for just transitions, I think the focus is justified. But in fact, there's probably even more urgency for adaptation, and I don't think that can be overestimated. So I really would reiterate the point there that we need more attention, we need more support and resources on adaptation to support the people and places that are on the front line of the climate crisis, already experiencing different forms of loss and damage. So I think in the run-up to COP26 this year and other policy processes, there's a real opportunity to advocate for even stronger adaptation action. And not just that, but to make sure it's connected to broader issues like sustainable development, social equality and justice, and of course, not least for young people who have a right to intergenerational climate justice. But let me come back to your question and say a little bit about what does child-centered adaptation look like. I'm going to draw on a study that I was part of a couple of years ago here in northern Thailand. The research was a partnership between SCI here in Bangkok, together with Plan International and the Sustainable Mekong Research Network. And really the essence of the study was to better understand, particularly young women and girls' impacts, vulnerability, and adaptation to climate change. And also what is their current but also future capacity to cope and adapt with a changing climate, not least the temperature changes that we just heard about. And I think what we wanted to do was not just capture the impacts of climate change, of which there are many, and there are very particular and acute issues related to children and youth. But we wanted to understand what drives risk and vulnerability among these communities, and viewed our findings through a lens of intersectionality. So to not just look at gender issues by themselves, but how they interact with age, with ethnicity, socioeconomic status, to create the vulnerabilities linked to the inequality, which was highlighted in the previous presentation, that are particularly putting young women and girls at risk to the impacts of climate change. So before I come to adaptation, I wanted to just share one very specific example of what that would mean. And it relates to the issue of water scarcity or drought as a risk, but I actually prefer water scarcity as a term because I think it focuses more attention on the management of resources, on the actions taken by people in decision-making power, rather than the natural hazard, which you might think you couldn't do too much about. Now, water scarcity was probably the biggest risk highlighted by the people that we spoke to in the communities in Thailand. And I think almost everybody across children, young women, teachers, school leaders, pointed to the worsening issues of water scarcity across these mountainous areas of northern Thailand. And what we found in many places was that acute water insecurity during times of scarcity is having a more pronounced impact on young women and girls, particularly in terms of household and job roles, education, health, food and nutritional security, livelihoods, and migration. There's a lot of different issues to unpack there, but I think the real take-home message is that when the going gets tough, the impacts are often put more on the shoulders of young women and girls. So for example, the role of collecting water in these communities, not all households have a direct source access to water. So collection of water is really important. And we found that it was the girls that were more likely to be called upon to assist their mothers in sourcing water, assisting with chores. And often this was bringing them out of school. So it affects their education as well as other areas of their development. So there's a lot more I could say about findings, but let me share some reflections about adaptation measures, particularly around enabling access to information, a key human right, of course, and building awareness. So the program under which this research was conducted was the Child-Centered Climate Change Adaptation Program implemented by Plan International, as I mentioned. And the program really focused on a multifaceted approach to building awareness and capacity. So not just at the household level, but also in the school level, across the community level, and also working with sub-regional and provincial governance systems to make more long-term change. One of the models of information diffusion that was implemented started with the integration of climate change knowledge into school curriculums. This is obviously quite a long process, but fortunately this program was able to be implemented over quite a long period of time. And over time, school curriculums did begin to reflect climate change issues. And there's evidence to show that the children that are educated at school are actually probably very effective at spreading that information within their households, across their families and communities. And for something such as typhoon early warning systems or even evacuation procedures, this kind of information sharing, awareness building is really important, because ultimately you can't reach everybody through a training or through an information campaign. So that just points to one example of the active participation that children can play in different forms of adaptation. But awareness raising isn't just about being aware of the risks, but also what you can do about those risks, even if it's at very small scales in one school, in a few households, etc. So children receiving the information that I mentioned as part of their education were also likely to be interested to partake in other adaptation activities in their schools and communities. For example, planting trees and grasses were used to mitigate landslide and riverbank erosion risks. And there was sort of an added benefit here of a stronger connection with nature. We hear a lot these days about so-called nature-based solutions as a form of adaptation or ecosystem-based adaptation. And this is just a small anecdotal example of children participating in that. And while these measures might be very localized, they may even be short-term, for example, needing to replace these trees and grasses on a regular basis. I think they represent realistic and fair opportunities for child participation while still ensuring safety and protection of child rights. I'd say that imparting knowledge and information is a really great way to empower young people at a very early age, of course, and make their participation in adaptation meaningful and hopefully long-lasting through their lives. So I have a lot more to share, but I'm going to pause there and look forward to hearing from Raul next, and then discussing with the panelists. Thank you.
Thank you, Michael, for this insightful presentation. There are so many points to take from your presentation, but what I see to highlight is adaptation measures around enabling access to information as a key human right you mentioned, and building awareness is quite important. Thank you particularly for sharing the examples from the region, especially from the gender dimension. And this is very important to cover for this webinar, the regional coverage of the presentation. And you talked about child participation, and as you rightly mentioned, this is what we will go further into with Raul. Thank you again. Now it's time to introduce you to our last speaker, last but not least, Raul Montenegro. Since 1980, Raul has been engaged normally in initiating role in an astonishing range and number of environmental activities and successful fights against governments and corporations. And in addition to all this, he has been having a full academic life linking science, practical proposal for change and activism. Raul is full professor of human evolutionary biology at the National University of Cordoba in Argentina and director of the Campus Cordoba at the Rights Livelihood College. He received in Sweden the Rights Livelihood Award, also known as the Alternative Nobel Prize in 2004. And the Nuclear Free Future Award in Austria. It's very impressive. I hope I didn't miss anything. Thank you, Raul, for being here. It's a great pleasure for us to have the opportunity to hear about your valuable experience that can inspire particularly young generations in taking action to stop climate change and biodiversity loss. To this regard, in your experience, how can we best educate children in a way that inspires and encourages them to actively and meaningfully participate in an environmental protection? And how can we educate adults to value child participation and child capacities in policy matters and decisions? And finally, can you share examples from your own experience of child participation in environmental policy making? Raul?
Okay. Good morning. Nice to be here. I think that it's very important, prior to any comments, is to remember that currently there are in the world around 2,000 million children of 0 to 14 years. Of these 2,000 million children, there are around 650 million poor children. Of this total total of children, there are around 84.5% of all the poor children live in Africa and Southeastern Asia. But more than this, there are 400 million children living under war and in conflict areas. This is a very important to have these figures in mind. A second important issue is that global climate change is not the worst problem we're facing. It is the change in global biodiversity and wars. And we need to take care not concentrate everything in global climate change, because we can be adapted with a lot of suffering to global climate change, but we cannot be adapted to the loss of biodiversity. Solely some figures. In the last 50 years, a total of 68% of all global biodiversity was lost. And the biodiversity loss can kill a lot of children everywhere. This is important solely to mention some figures. Children, according to different cultures, they have a lot of information, and according to their ages, they can provide a lot of valuable information for the adult society. But they usually they are more receptors of information than providers of information. And particularly, it's important to say that children, they have their own perceptions of everything, of suffering, of joys, and how the world is functioning around them. But they don't have voices. And this is one of the tragedies. They suffer, but we don't listen to their suffering. And it's important to say that their information and their knowledge is very important for all the entire society. Another important thing is that unfortunately children face two powerful barriers for being part of the society, not solely ornamental, because children are most of the time ornamental, you know, big meetings and children making songs. No, children, they are suffering and they are also providing information. These two barriers, one is the disregard for the knowledge, particularly in poor children and indigenous children. They some kind of disregard. They are children, they don't know. And the second barrier is the permanent violations of their right to express themselves. And I don't understand what this is happening so widely. We have a convention, the Convention of the Right of the Child, and Article 12 clearly states that they have the right to be listened by the adult society. Their voices are not taken in account. This is one of the problems that we face. There are more subject people, passive people. And the funny thing is that adults produce most of the problems. Adults produce most of the so-called solutions. But children, they are suffering now, and they will suffer in a great manner all the destruction produced by adults. But they don't listen it. This is important thing. This issue of not being active participants is a crazy thing, because the convention provides to them the rights, but such rights are not respected. But very strangely, children are soldiers, children are sexual slaves. That's for the adult society. They can be soldiers, but they are not providers of information and of knowledge. We produced it as example, Voice of the Children International Campaign. We worked with UNICEF, another organization. We worked with 600,000 children in around more than 40 countries. Like an exercise of providing them with channels for expressing their visions, their claims to the power. Trust to the power. Decir la verdad a la gente. And this was a very, very interesting example, and we can discuss maybe something more. But the more important thing is that we consider that children are part of the source of wisdom of our societies. They are not ornamental things. They are part of the sources of knowledge, and we can learn from children. This is a very important thing. We can learn of children. In which areas are very important the participation of children? Because United Nations produced the convention, but United Nations is one of the bodies that don't accomplish Article 12 of the convention. Article 12 is not accomplished by the same organization that produced the Convention of the Child. And one of the issues that children need to introduce their voice is in global conventions, biodiversity convention, global change convention, certification. They need also to participate in environmental impact assessment. When you are building a big work that can affect the health, affect their life, children don't exist. Solely adults intervene in environmental impact assessment. This is the second universe. The number four, sorry, the three is the peace process, because I underline that 400 million children live under war and in conflict zones. Like now in this moment in Colombia, where the government is killing people. And it happens in Myanmar and Thailand, where not solely adults are dying, also children are dying. Thus, their participation in peace processes. Also, in the design of a new convention on lifestyles, because children are poor, children suffer, children are used as slaves, because it's the result of a lot of lifestyles that are not sustainable. Thus, they need to be part of the design of this new convention on lifestyle. One indigenous people, one child in the forest in Jabotiwe, where I work in my country, they spent around 3,000 kilocalories per child per day. In the same momentum in United States or in Europe, a child spent around 300,000 kilocalories per child per day. 3,000 and 300,000, the same child of the same age. Thus, this convention need to face which will be our control, our changes in this convention, in these lifestyles. Number 5 is this the importance of providing children for channels, ways for expressing, for transmitting their visions and their knowledge. And particularly, I underline that we need the input of children in education and in also in the health systems, particularly now in the pandemic. Now the pandemic is affecting more adult people, but we know that SARS-CoV-2, which is the virus, is a beta coronavirus. They are moving, and it is very possible that new variants of virus will go against children, and this is maybe the next chapter. That's we need our message is that we need really to improve Article 12 of the Convention of Rights of the Child, but not as ornamental as in a lot of United Nations meetings or in national meetings are doing, when children making songs, you know, or children explaining poetry. No, we need children as participants according to their age, because each age of children produce their particular kind of wisdom. And I think this is the challenge. We need to listen their voice for visions their voice claiming for words. I think that Greta Thunberg showed to us that children can make more things than thousands of adult people. That this is my summarizing my position, that we need to fight. I fight all the time, but we need to fight and to make children be part of the society, not to be goals of studies, targets of advertising, or targets of, I don't know, small things. They are part of the society, and we need to listen them. This is, I think, my final message. We need to listen them. Hmm?
That's wonderful, and that's a very inspiring point to finish. Thank you, Raul, for your intervention, and it was a truly a great inspiration for us. And thank you once again for emphasizing that children should not be considered as trophies, and we as adults should do no harm. And the two barriers, of course, that you mentioned, poor and particularly indigenous children in your area, and the right to be expressed, are important points to consider. Before moving to the Q&A session, I have another question to you, Raul. Well, the government responses to climate strike protests are not ambitious enough. So do movements need to radicalize themselves and their measures? What is your opinion about this?
You know, one of the things that we need to take in account is that our planet, our human planet, is not uniform. It's not an homogeneous planet. That means that we have children in very different situations, and children and adults in different situations. That's the first issue to be considered. Is that if you are living in Myanmar, if you are living now in Colombia, it's not the same if you are living in Iceland or if you are living in the Samoa. Thus, we have like a puzzle of different situations. This is important to say. And we are totally convinced that we need to radicalize all the society. When we said all the society, we include children, but not transmitting to them the adult techniques of fighting or the adult ways of protesting. We need to even to interact with children and to promote their own ways of producing change, which is very different of the thing that I can, as adult, design something, but children, they have their own methods, but they have no ways for transmitting. That's I think that for surviving, we need to radicalize everything, and I totally agree with Greta. She's also a partner of the Right Livelihood Award, and her message was, I think, clear in that is that they have voices, they have tools, they have proposals, totally different. The problem is, I insist, is that we don't create channels for listening them. Thus, we need to radicalize totally, because we cannot continue in the way we are walking, and we are destroying. But we need more partners. When I say this, I talk from the adults parts. We need partners, but we need children partners, not for following the adults' views of everything. We need children as partners, providing their own visions and their own tools. Mm? And I think that for me, this is the way. But we need also to change our minds, because children of 10 years, they are not the same children in Lesotho. They are not the same children living in the forest that the stupid person of Jair Bolsonaro is destroying. Remember that Jair Bolsonaro, he promoted between August 2 years ago, from 2 years ago till the mid of the last year, more than 11,000 square kilometers of forest, including people, have been destroyed. That we need to take into account that children are not homogeneous, like adults are not homogeneous.
Yeah.
And I think that we need to radicalize, but listening them, and not to use children as recipients of our knowledge, our histograms, our formula.
Yeah, well, that's an interesting point to take, that for surviving, we need to radicalize everything. So yeah, thank you, Raul, for the answer too. I think my next question will go to Elizabeth, if you don't mind. In your experience undertaking research in lower income countries, have you recognized patterns that through the involvement of children and youth have led to more efficient climate change policies, rather than taking the conversation that we're having with Raul?
I'd like to say yes, but I'm going to say not obviously. I think there's two perspectives. One, I'll be brutally honest, as an academic, to some extent, doing research with children puts on a whole extra layer of getting ethical clearance. And so sometimes we sort of take the easy way out and we go, well, it's just easier not to do the research with children. So to start with, you've sort of got, it's harder. So most surveys will start off with adults, and then, if you're going to do more research as an academic, you might then include children. So the starting point when you're doing primary research is, it's always going to be a smaller subset of people who are looking into these issues, which is highly problematic. But I suppose, what we need to do really, I think, as academics, not as, I think to some extent, this is probably a question to Raul and Michael, but to some extent, from an academic perspective, what we need to do is provide evidence. And that enables other people to provide voice. So to some extent, we can provide an indirect voice, if you like, by providing the kind of evidence that Shura is providing now. But then the question is, what do you do with that evidence? And so I think from an academic perspective, from people like us who do research, we certainly need more studies that show that differential impact on children to enable policymakers, activists, people actually working in sort of the NGO sector, for example, to have that evidence to say, look, this really matters. The children are being differentially affected, and there are policy approaches where you can actually prioritize children. So I'd say probably we're not doing enough. But the one thing we can do is provide that evidence as to how children are being differentially affected.
Thank you very much. It addressed most of my question. And thank you once again for the interventions that you have. Now I open the Q&A session of this webinar. And we'll start with questions we've already collected through the registration link, but please, this concerns to the audience, feel free to pose additional questions and reflections on what you just heard from our amazing panelists. So there is a question for Michael. Michael, what recommendations would you have for different actors to strengthen child-centered adaptation interventions for young people?
Thank you, Mariam. Yeah, that's a big question, and I think through Raul's intervention and others, I think we've heard some options already. I think maybe I'll start with referring back to the study that I talked a bit about earlier, and maybe just pick up on a couple of the key recommendations that we produced there. Firstly, recognizing something that Raul said, which is about recognizing and empowering the knowledge that children possess is very important, but access to education is also very important. I think that is still a way for children to shape their understanding of things, to develop critical thinking, for example, and to grow into people that might be able to support that radical change for a long time. So access to education, I think, is one key recommendation. As we've also already heard, focusing on empowerment towards leadership in climate action, I think, is really important, particularly amongst young women and girls. And also particularly amongst communities which are often marginalized or not part of the conversation, such as in the conventions that Raoul mentioned. And I think the UNFCCC Paris Agreement would be another example there. But also the state as duty bearers have responsibility to provide social safety nets, options for sustainable livelihoods, for example, as well as bringing in different perspectives on water resource planning, for example. So there's a lot of different things there at different scales, but I think one thing that comes out of my work is that traditional adaptation measures, as many people would think of them, are great, but to implement them in a vacuum away from broader development systems, broader access to services, for example, that's really a key part of adaptation, and resilience as well, that is equitable and addressing some of the marginalizations that we see across the world. And just to close out, again, Raoul mentioned elevating the voice of children, and I wanted to promote work done by a multiple number of organizations here in Asia Pacific that directly spoke to more than 10,000 children and youth to find out what they wanted to do in relation to climate change action. So there's a report called Guardians of the Planet, Asia Pacific Children and Youth Voices, which I would encourage everyone to go and read to find out more about what it is that children and young people want to do. Thank you.
Great. Well, thank you for addressing that question too. And we've received, I see one more question. I think it's more towards Shoro from Alexander. Can we actually talk about child mortality without talking about poverty? You mentioned inequality. Isn't inequality and other socioeconomic factors a stronger driver than the changing climate?
So I'll take a stab at this, and Elizabeth can put everything into context as she always does. So that's a very important and interesting question. But what I'd like to say is we do control for both. We take into account both the climatic stressors and socioeconomic drivers such as education, dependency ratio, and most importantly, income inequality. And what we do find is that income inequality is, yes, it's a strong driver. And what our results show is that social improvements in socioeconomic drivers will help to negate the negative impacts of climate change or reduce the negative impacts of climate change. But the fear is that at some point, the impacts of climate change will simply overwhelm improvements in socioeconomic determinants in countries, especially in countries which already are low income and or have low human development indicators, right? I'll pass the baton to Elizabeth now to wrap that up.
Thanks, sure. I actually did pop a little text response as well. I wasn't sure if we're going to have time to answer that question. Yeah, I think, reducing inequality, well, it's a moral imperative, I think, for many of us, isn't it? And certainly, yes, with or without climate change, reducing inequality, we generally pretty much know is going to help with a lot of those indicators linked to child health more broadly and child mortality, your question. Also, I sort of added in the chat as well, that when there's really high inequality, it makes it really hard to implement some of those environmental policy instruments that we want to implement, whether that's to mitigate climate change or to undertake adaptation activities. And so I think you get a double benefit from reducing inequality. Yes, in the broader sense, it's much easier to, you're going to have much more impact on improving child well-being all round in terms of education, in terms of health, in terms of reduced mortality, in terms of maternal well-being. But also it just makes it so much easier to actually do something about climate change. And I think I agree with Shura. I try to focus my work on mitigation, not because I don't think adaptation isn't essential, as Michael said, and we need it right now because unfortunately we've let climate change run away. But I guess I think from Shura and I's perspective, we need to mitigate as much as possible, because you do get immediate health benefits. You know, if you reduce air pollution, you immediately improve children's health particularly, and you're mitigating. But also when we look at adaptation, we really need to look at adaptation that allows for those more equitable, sustainable development pathways. And so once you look at adaptation as part of the solution for reducing poverty, and you can actually see that it's consistent with climate change mitigation, then you've got to bring reduced inequality into that. And I think it's a topic Shore and I are looking at more and more, and just thinking it's incredibly important. As an economist, we don't always see the sort of double benefits of inequality, not just a matter of, you know, you do your policy and you redistribute wealth afterwards, which is what economists like to do. They kind of almost separate efficiency and welfare and inequality, but actually it's easier to mitigate and adapt if you've got reduced inequality. So I thought that was a great question. Thank you.
Yeah, well, thank you for a great answer too. Unfortunately, we have some time constraints, and thank you, Shuro, thank you, Elizabeth. With this last answer, we came to the end of today's webinar. We're forced to, which has been really interesting and informative, at least to me, and I'm sure to our attendees as well. I wish to thank our panelists, once again, Elizabeth Robinson, Shuro Dasgupta, Michael Boyland, and last but not least, Raul Montenegro, for being here with us. And thank you for sharing your experience, not only professional, but also personal, and for having raised so many interesting points that we have to consider when we talk about the link between child rights and adaptation to climate change. So, well, this webinar has been recorded and it will be soon available on the Global Campus website for you to take a look at it once again, and to share it with others who are not able to join us. This was a very fascinating discussion. It was heartwarming to see how many people and institutions work on the climate change and particularly child participation. So once again, thank you all. It's been a pleasure to me to be with you today, and we're looking forward to meeting you again at another webinar Global Campus is going to organize. Thank you very much.